Now we're going to talk about the cognitive piece, arousal and sleep cognition. These are what people think about sleep and how that can keep them awake. Let's see if I can get this going. Oh. Now, basically, the idea to get across to people is that sleep is effortless, especially when the sleep drive is strong, like they haven't been napping, they've been up all day, and the timing is congruent with the circadian clock, and the mind is calm. So what we do with it often, the mind calm part is what we can help with cognitive stuff. People with insomnia tend to make the sleep effort, as I mentioned before. They either try not to think about sleep, they try to think positive. Like I sometimes have patients who think like, it doesn't matter if I don't sleep. It doesn't matter if I don't sleep. Oh, I'm sure I'll sleep tomorrow night. It's going to be okay. And they're just working it. They may adopt rigid rules about sleep. They have to be in bed by 9. They have the safety behaviors we already discussed. Basically, the greater the sleep effort, the greater the arousal, right? So the harder you're trying, the harder it's going to be to sleep.